Thanks for checking out this week's Ask Me Anything videos. As you can see, I've got a little difference around me. This week, in the next couple of weeks, I'm going to be doing these videos from my home office versus my practice office. So let's get started. The first question comes in from a guy, and he writes in the following. I'm a 35-year-old male having issues with erectile dysfunction over the past few months. This is new in the last couple of months, and I'm starting to freak out because it's not fixing itself. Why is this happening? Well, you're 35, it's not common for a 35-year-old to have this type of issue. Now, what I mean by common is, are there a lot of people that deal with it? Yes, but it's not something that the majority of 35-year-olds deal with. There's a couple of different factors that can definitely be affecting what's happening. So we want to start by making sure there's no medical issues. So the first thing that you want to think of is ruling out medical issues. Make an appointment with your primary care doctor and go and have things checked out. See where your hormone levels are at. See on a whole, from a medical standpoint, are you healthy? Are there any type of issues happening? They'll probably, they'll do labs and different things like that. You want to get that taken care of first. Don't let your shame, your pride, your ego, whatever it is about having issues with ED and difficulty maintaining or being able to keep an erection, don't let that keep you from seeing your doctor. If you don't speak up, you might not get the resolve you want. So make sure you take care of yourself. Then when you rule out the medical issue, your doctor may recommend that you visit a certified sex therapist, or you start some type of sex therapy with someone who's licensed to check out if it's a psychological aspect. And for majority of men, it's a psychological issue that's happening for them. So if there's no medical issue, meaning the hormones, everything is within good limits in the right range, there can be a number of factors. The other thing you want to check on from the medical standpoint is it a side effect from medications? Because many medications have sexual dysfunction as a side effect. You never want to stop medication on your own. Make sure you seek the advice of your doctor before doing anything medication advised. So from a psychological standpoint, what's happening with the stress level in your life? Are you feeling stress at home, at work, financial, career? Are there any type of stressors that's affecting you? And this is enough to definitely cause some dysfunction happening. Also, if there's conflict in your relationship, if there's issues, if there's concerns, issues with trust, if there's pressure put on you in different ways, can definitely affect your ability to maintain an erection. Also, anxiety, depression, alcohol and drug use. Most people don't realize that alcohol has a huge effect on causing erectile dysfunction issues and having issues during intimacy and sex. So there's a lot of factors that can go into it. What helps with sex therapy is you have the ability to assess it, check things out, talk about tips and techniques that you can do to help improve this, or if you're in a partner relationship, there's tips and techniques that can help this as well. Most important, don't remain in silence. Don't let any shame or don't let your pride or ego get in the way from you seeking help. You deserve a healthy and happy sex life and relationship with yourself or others. So make sure you speak up and get the help that you deserve. And I wish you all the best. I know, but while you taking some of these suggestions will help you and help you get back functioning where you feel confident. Thanks so much for sending in the question. Make sure you keep me updated on how things go. Thanks.